Research being done at UW Health has the potential to help more than 100,000 people in Wisconsin. Those are individuals dealing with severe and incurable vision loss.
Stem cells offer great hope for helping with blinding disorders. In a story that you'll only see on News 3, Dave Delozier shows us how some are trying to profit by turning hope into hype.
I have these three grandchildren.
They are the images that a grandfather lives for.
To see all of what's going on in life, you can't miss that.
But a few years ago, that's exactly the prospect Russ Rothman faced.
And they noticed a high spike in my eye pressure, and in fact it was the first indications of glaucoma.
A diagnosis that made him realize how important this is.
It's demoralizing, and then you try to say, well, how am I going to deal with this?
I have a tremendous amount of hope.
And that is what researchers at UW Health and the McPherson Eye Research Institute have been working on for better than a decade. They are looking at using stem cells as a treatment for blinding diseases.
The technology is very strong, and there's a lot of real potential in what we and other laboratories are doing.
But while stem cell research holds great hope, it won't come as quickly as some would like. More research and trials must be done to assure it is safe and effective. And in the interim, there are those who would like to turn hope into hype.
As you get closer and it becomes a little more of a reality in the near future, that's when folks start to look to try and make a buck.
While researchers at UW are working on stem cells, some clinics around the country are trying to sell it. Patients can lose their money and worse.
So there have been cases, for instance, in a Florida clinic where people have been blinded, not by the cells themselves, but because of infection that came along with the injection that they received.
Best advice is to educate yourself, and if something sounds too good to be true, it probably is.
I probably asked more questions than they wanted to hear.
Russ Rothman asked those questions and received treatment from the ophthalmologist at UW Health.
The end result, Dave, is that you come away with a sense of you are with the A-team. You are in good hands.
Using treatments currently available, his eyesight is now good, which is something not lost on him.
Try closing your eyes and pretend you can actually grasp everything else. No, you need to be able to see.
Because no grandfather would want to miss this.
You know, look at the look.
In Wanakee, this is Dave Delozier, WISC News 3.
The research team at UW Health is working toward a clinical trial using stem cells to treat blinding diseases.
And while anyone dealing with vision loss wants that treatment to come sooner rather than later, the research and the clinical trials have to be done to assure that everything is safe.